A patient presented with lesions as seen in the color image. Histopathological reveal suprabasilar split and presence of Zang cells. What is the diagnosis? So your diagnosis would be Pemphigus vulgaris. So what is Pemphigus vulgaris? Pemphigus vulgaris, it is a autoimmune intraepithelial blistering disease that will affect skin and the mucous membrane. What you will see here is circulating autoantibodies that are directed against the keratinocyte cell surfaces. So this blistering in this disease is due to abnormal production of autoantibodies that will direct against the epidermal cell surface glycoprotein desmoglein 1 and 3. So these desmoglein, they are the component of desmosomes. So what the autoantibodies will do, they will attach these desmosomal components and inhibit the molecular interaction. So as a result of this attack on the desmosomes, what you would see a split that develops within the epithelium. So this split is responsible for the blister formation. So the Pemphigus vulgaris involves the oral mucosa, typically in adults at age of 50 years. What you would see here is the patient will report with the bulla formation. So there will be vesicles and bulla. So these lesions will contain thin watery fluid shortly after development. So when the bulla, it will rupture, it will leave a raw surface. So a characteristic feature of Pemphigus vulgaris is that a bulla can be induced on normal appearing skin if a firm lateral pressure is applied, and this is positive Nikolsky's sign. On histopath examination, what you would see is the superficial layer of epithelium, they are stripped away, leaving only the basal layer of cells that has been described as row of tombstone. The cells of spinous layer typically appear to fall apart and they are termed as acantholysis, that they term a round shape appearance, and these rounded cells are known as Zang cells that can be seen in exfoliative cytological preparation. The diagnosis of Pemphigus should be confirmed with which test? By the direct immunofluorescence test, by the Michel solution. So when with this procedure, antibody IgG or IgM and complement, usually C3, can be demonstrated in the intercellular space between the epithelial cells. We can use indirect immunofluorescence or ELISA can be used. What is the treatment? The treatment, it is a systemic disease. Therefore, treatment would primarily consist of systemic corticosteroids. Usually the prednisolone is given, or we can give immunosuppressive drugs or azithromycin.